Okay, this is a sclerology chart. Okay, we separate right iris, right sclera and the left sclera, and you can see all this is we call it a capillary vein. Okay, and this one for iridologists we define as a stress pattern. So sclera divide into a various reflex zone. For example, this upper level is a brain, right hand side is the lung, left is the thyroid, and the below is colon, small intestine, or all the elimination organs. Okay, like for example, when you see, okay, when you look at here, okay, this is a stress line. We call it encapsulation stress, and this one is comprised into this liver area. So normally, if the clients that got this stress, possible there is a fatty liver, like just now I mentioned, okay, and you can look at here, okay, this one we call it a advanced stress, okay, and there's another advanced stress towards to this area, okay, okay, if you look at this, okay, this is the brain. Okay, the client is experiencing a brain stress area. Okay, maybe he got headache, migraine, or insomnia, or having a sleep disorder problems. Okay, yeah. Besides checking the sclera, okay, I'm also looking for the iris. We call it the iridology. Okay, and I'm using this iris scope. Okay, is to check. Actually, is to make a photo. Is to snap the photo from the client's iris, okay, especially for our Asian, because our iris mostly is a brown color. So I'm using this special iris scope is to taken the brown iris from the client. After that, I will take the picture and then convert into this screen. Okay, so this is the iris. Okay, and left and right. Okay, for example, this is the left iris. Okay, and you can see all this is a stress pattern. Okay, and this stress pattern again is reflect a certain organ zone. For example, here is, okay, for example, this one is we call it a lacuna from liver. Okay, and here is lacuna from the kidney, and all this lacuna is represent a low energy area in this zone. Maybe it's also considered a stress lah. Okay, and you see this one, this is a pupil. Okay, this is the pupil, and surrounded this pupil we call it a nutrition zone. Okay, it's comprised of colon and a small intestine, and this here is we call it a ciliary zone. Okay, all the thyroid, spinal, liver, pancreas, kidney is located here. Okay, I'm just reading the stress pattern from the iris itself. If okay, actually the stress pattern or the problems been highlighted. Okay, I will advise the client. I will advise them to take some. Okay, first of all, to advise them about their diet, their living style, their living environment, which is contribute to their physical problem. Okay, and the second thing is I will write some supplements or some vitamins for them. Okay. Normally that's what I do. And if a client got these emotional problems, okay, then I will do it another therapist for them. We call it the emotional freedom technique. Okay, and the other thing is that I'm also doing this thing, food nephrology. Food nephrology is also same with sclerology and iridology. Okay, both three techniques is to okay, like for example, food nephrology. The main purpose of doing this checking is to check whether a patient's got any fungus or parasite involvement or not. So from the food itself we can know. Okay, and how do I know? Same is to check their stress pattern. Okay, this okay, this is the thing that I'm checking. Stress pattern. Okay. Again, this is a stress pattern. Okay, all these lines got their own meanings, and each of every zone is represented here. Okay, maybe you can't see it. This is a callus here. Okay, so I can know that this person is experiencing a lymphatic congestion. Okay, or he might have a headache. And these two, you see this small line here, this is the throat area. So maybe he is having a throat stress, and this is the stomach area. Okay, and you can see the line from here up to here, and this is the heart area. Okay, maybe or possible this client is having a blood circulation problem. Okay, that's how that I derive from this stress pattern. Okay. Normally these three techniques is to highlight for the clients to know about their overall health conditions. Okay. Whatever problems that I highlight is just for their reference only. Okay, so that they can know about their overall health conditions, and they can take precaution and prevention. If they want to know more about their problems, so they have to refer back to their doctors. That's it. Okay, actually the main reason that I'm come here, I'm in service here about 3 years already. The main purpose that I'm giving my specialties to service here is because of I feel that this environment, this energy environment is very good. Okay, I can help Chinese, Indians, and Malay. Okay, and we don't see about the colors. Okay, and the most important thing is we are giving our love and compassion. Okay, to this environment. This is my main purpose. Okay.